To the Keeping Fall Athletes Healthy webinar replay. We're going to talk about a couple hot topics right now that are important for fall athletes. This is in regards to anyone from recreational age to youth, high school, even collegiate athletes starting up preseason. So here in Cleveland, that's mostly football, volleyball, cross country, and soccer players. But in different parts of the U.S., I know there's different sports that are starting in fall season. These general things that I'm going to talk about, I really do apply to anyone though. We're going to talk about training in the heat and signs of heat illness to watch out for. We're going to talk about concussions. This is such a hot topic right now, and it has been for the past few years as we're learning more and more about the complex nature of how some of these concussions kind of present as, and as the brain is so complex, an injury to the brain really is a tricky thing to rehab athletes from, and it's a lot more complicated than I think we all thought. We're also going to talk about ACL injuries and ACL injury prevention. This is another common injury in sports right now. It has some important and unfortunate ramifications. I'm going to talk about explaining the risk factors for it and what the latest research says about ACL injury prevention, or as I call them, risk reduction programs. I'm going to touch on fractures, muscle strains, and other common injuries, the signs and symptoms of each, and what to do if you suspect that your athlete has a fracture or a muscle strain. And then we're going to finish with signs of burnout in athletes. I think this is a topic that's really overlooked, especially in our youth athletes that are playing one sport year-round, more so than when I was growing up, where it was common to play multiple different sports. And burnout's really common, and as I mentioned, I think it's overlooked. And I think it's a really important thing is sports should be fun no matter what level you're competing at. You should still enjoy and love the game that you're playing in. And if you're burnt out, the likelihood of you sticking with that sport over time is lower. So even later on in life, staying active and staying healthy and actually enjoying sports for what they are really could be addressed by paying attention to things like burnout in some of these, especially, like I said, youth athletes that have way too many playing hours and multiple teams of the same sport. So moving on, here is my background, just so you all know why I'm talking about this. I was a Division I soccer athlete at Duquesne University in 2000 to 2003. I then went on to physical therapy school. I'm a certified strength and conditioning specialist and a board certified specialist in sports physical therapy from the American Physical Therapy Association. I've also been an assistant soccer coach at a local high school for 7 years. So between playing and coaching, I have quite a bit of experience dealing with fall athletes and all these things that crop up at this time in preseason or even throughout the season. Currently, I'm a member of the U.S. Olympic Committee Medical Network. I'm chair of the Female Athlete Special Interest Group in the American Physical Therapy Association, and I'm the owner of CLE Sports PT and Performance up here in Cleveland, Ohio. I worked previously for Cleveland Clinic Sports Health. I was there for about 9 years, but I left a year ago to start my own practice. I wanted to be on the community working with athletes versus a hospital setting, because I really believe that working with the athlete in their own environment, their field, their gym, being around for their teammates is the most beneficial thing for them. So I specialize in sport-specific rehab. It's a blend of training and physical therapy. I also specialize in return to sport testing for athletes. So basically trying to figure out if an injured athlete's okay to compete in an upcoming game, match, etc. So first topic, heat illness. Now up here in Cleveland, it is 90 degrees this week. It's been quite a hot summer. So this is, I think, especially important compared to past years where things have been a little bit cooler. We're going to start with the National Athletic Trainers Association position statement on heat illness. This is a fantastic reference if anybody wants it. It's online, it's available, and it's something that really, it gets updated every few years. The last update was in 2015, and this really breaks down kind of what the best treatments are for different kinds of heat illness. So just to go over the types of heat illness, there's 4 of them. Basically, some people think that these occur on a continuum, but they really don't. They usually are separate entities, because if an athlete presents with heat cramps, they're usually going to pull themselves out of a competition, or heat syncope, which is, fainting episode. The likelihood of them returning and having it develop into heat exhaustion or heat stroke is not really going to happen unless they don't pay attention to medical advice and would go back in a game. But that doesn't tend to always happen. There is a blend between heat exhaustion and that could progress to heat stroke, but heat cramps and heat syncope are sometimes two kind of separate entities. So to go over definitions of these, heat cramps, I think either you've seen an athlete have one of these if you're watching a game or a match. They happen a lot in soccer, or you've had this happen yourself. I know I have. They're not fun. They're painful muscle cramps that kind of just come on. They're caused by dehydration or lack of electrolytes, although we're finding nowadays that many, we're kind of refining our understanding of the imbalances that cause these. And I think you're going to see even more. It's not just a potassium depletion. It's not just a dehydration issue. It's other things too. And stay tuned, because there's a lot of research being done on this topic. They usually occur during preseason because of the heat, because of it not being used to the workload that some athletes are going through during preseason training. Heat syncope, this is a fainting episode. Heat, hot weather contributes to decreased blood flow to the brain, and then you have this loss of consciousness. It usually happens after prolonged standing. I have to admit that this actually happened to me this summer. I coach a half marathon and marathon training program, so I was working with a bunch of runners. We did our training run. I was standing, talking to the participants in the group. We were kind of waiting for other runners to finish. I had been standing in one place for a while, and then had this exact same thing happen to me. So I can speak from experience that it's kind of a scary thing when it does happen. Heat exhaustion, this is the most common heat-related condition. This is what you think about when you think about heat illnesses. It can happen in anyone. So it's important to understand that it can happen in a youth athlete, it can happen in an older athlete, it can happen in a professional athlete. A lot of different factors can go into play with this. Basically, what ends up happening is there's a cardiovascular insufficiency, so not enough blood is being pumped to the heart, and it may or may not be associated with physical collapse. I think a lot of people think about people dropping to the ground from heat exhaustion. That doesn't always happen. This is signs of heat illness here, and kind of minor heat illness, so that heat exhaustion, even though it's minor, it's still not anything to be messed around with. This is part of an infographic that I got from the National Athletic Trainers Association. It's online. The whole infographic is another fantastic reference. It's something that would be great, I think, posted in a locker room of a sports team, or given out as a handout to athletes, just so they understand different aspects of heat illness and things to watch out for. So again, signs, dizziness, cramps can be part of this, lightheadedness, and then lastly, heat stroke. Heat stroke can be fatal. It has to be recognized quickly. And it's basically when the core body temperature gets above 105 degrees Fahrenheit. The body can't keep up with the heat that is generated from working muscles, or it's the body's cooling response is impaired. So the body's not sweating, and for some reason it's excess clothing. Maybe the athlete was dressed warmly or has to wear, shoulder pads or equipment that's not letting them have that cooling response work as well as it should, or any other reason. There tends to be neurological symptoms with this, because the central nervous system is affected with it, and it can progress to multi-organ failure, and as I said, it can be fatal. So early warning signs of this: headache, dizziness, but then confusion and disorientation. You have either excessive sweating, or you see the athlete with chills or goosebumps too. They may be nauseous, they may vomit, excessive fatigue, more so than what you'd see when they're participating in their sport. So other signs of the heat stroke, as I mentioned, the core body temperature is more than 105 degrees. Now, I realize that most coaches and parents don't carry around rectal thermometers with them, but other signs that you would be able to notice to know when to call 911 and have a medical professional take the athlete's core body temperature would be signs of nervous system dysfunction. So this is the athlete suddenly being confused. They might be aggressive, or they may lose consciousness, something different than heat syncope. You'll see rapid breathing, and you'll see an increased heart rate. The athlete may have a seizure, and their blood pressure will very likely drop. So going back to heat cramps, we're going to talk about what to do for each one of these things. So first thing, with an athlete with heat cramps, you want to remove them from exercise, get them to a shaded area. You want to massage, kind of gently knead the muscle and very gently move the joint. Be careful with stretching these. I think everybody's seen on TV, an athlete will drop down with maybe a cramp in their leg, and people will run on the field and just do a very quick stretch to the area. Well, this cramp is caused by, there's some kind of chemical imbalance reaction causing a neurological reaction to the muscle. So a stretch is actually not going to make the muscle stop cramping. It's got to kind of run its course. And as it's cramping, and if you're trying to quickly stretch it in the opposite direction, the thing that's going to give is the muscle. And you could do some damage to the muscle, which is going to affect that athlete's ability to get back into playing when they are feeling better and they are able to return to play. Give cold fluids, give food with a high salt content to replenish electrolytes. There was a really interesting article that came out earlier this summer talking about things like spicy foods, and I believe it's the liquid, the spicy kind of liquid that has some kind of chemical makeup that can actually help prevent these from happening. I'm not sure of the exact details of the article, but stay tuned. I think you may see a little bit more of this in the coming months, or even throughout this year. And as I mentioned, there's a more complex relationship than simply giving water and a banana or potassium, but I think it's a good start, and I think that's the first line of defense. So those things sometimes are readily accessible, food with a high salt content, or a lot of athletes have a banana or races or different things they're carrying, things like that. You want to replenish electrolytes and potassium. Heat syncope. So when this happens, when the athlete has that fainting episode, you want to get them out of the heat, get them into the shade, help them sit and lay down, and get their legs elevated so that you get that blood flow pumping back up to their heart and their brain. You want to rehydrate them and monitor their vital signs. So if anything changes, call EMS. So if their airway, breathing, circulation, any of those things changes, it's an emergency situation. They will very likely feel better in about 10 to 15 minutes. But monitor them very closely, and if they don't, absolutely call 911. Now, when somebody has a heat syncope, they really should have a medical clearance before returning, just to make sure that there's nothing else going on that may have caused this. If somebody's heat cramps, they can probably go back in the game as soon as that cramp is resolved and as soon as their muscle is resolved, and they can play pain-free. But heat syncope, they really should get that checked out. What to do for heat exhaustion? Again, get the athlete to the shade. That's the common denominator with all these things. Remove excess clothing if needed. Elevate the legs again. Get the athlete cool. So whether you have fans, you have rotating ice towels, ice bags, anything. Also give fluids for rehydration. Can these athletes go back to play? Well, in a word, no. They really shouldn't return to sports for 24 to 48 hours. That their body needs to recover from what it's just gone through in the heat. And medical clearance is recommended before they do go back to play. And when they do, you really should increase the intensity and the volume of their exercise, or clothing, and even equipment if it's a football athlete or somebody that has to wear a lot of equipment. In terms of heat stroke, as I mentioned, this is an emergency condition. Call 911 right away and get the athlete cooled down as soon as possible. The gold standard for this is to do whole body ice water, just getting them immersed in a tub or a pool with ice and water. If that's initiated within 10 minutes, there's a 100% survival rate. If that's not possible, I mean, some races, marathons, those kinds of things have cooling tubs. Sometimes they're on the sidelines of football practices, but sometimes you're at a field and that's just not possible. Then try to cover as much of the body as you can with cold rotating towels, ice packs, or if there's a locker room nearby, getting them in a cold shower. That is also very important. Maintain the airway, breathing, circulation, monitor those things. As we had mentioned, that this could progress to multi-organ failure. So making sure that those things, if be ready, if you have to do rescue breathing, if you have to do CPR, those kinds of things. And as I mentioned, call 911 and get EMS there as quickly as possible. So now that we know what to do and now that we know what each of these things are, how do we prevent them from happening? Acclimatization is really the best thing, and that's taking a week or two to get the body to cope with heat exposure. So just some general tips: don't participate in more than one practice a day in the first 5 days. 2 a day is really not a good idea. Also, don't practice more than 3 hours a day. It's really not necessary, especially in youth athletes. You're not going to get any more out of them after 2 or 3 hours. So having a 4-hour long practice, whether the heat or not, I really don't think is the best idea from a coaching perspective anyway. If you want to keep the team together for a full day, maybe plan a different activity indoors, a team building activity, in an air conditioned area, a swimming recovery day, that kind of thing. But they really don't need to be practicing more than 3 hours a day. Gradually increase the intensity of practice. Don't go on day one making them, run the gauntlet of sprints and everything you can throw at them. It's not a good idea. Have cooling methods available for when they're taking breaks and give them frequent breaks. And also just educate your athletes on the hydration before, during, and after practice. Especially in youth athletes, they need that reminder that, on their way home from practice, it's probably not a good idea to stop at Starbucks and get a Frappuccino. Maybe they should have some water or a sports drink or that kind of thing, or pop, or those kinds of things really need to be watched, especially in the heat. This is a reference, and if anybody would like this link to, obviously it's going to be up on YouTube, but this is just a really nice chart talking about heat acclimatization, just talking about the number of practices, progression of equipment, just different things that way. They suggest, which I find interesting, first 5 days just practicing one session a day, but then after that, adding a second practice at 2 a day, but really every other day with that 2 a day. So not going from 1 to 5 days of just one practice a day to second week of 2 a days, just phasing them into that. And this is another chart that the reference is below. This was brought to me by one of the runners in the half marathon and marathon training group that I'm coaching, and it's a really interesting chart showing the impact of temperature on pace. So as you can see, your pace per mile really increases. It could be up to 20% in high heat situations. So if you have a fitness test planned for your athletes during preseason, if you're coaching a team, it's important to understand that at hot temperatures, you may have to adjust your passing time for that test. So this is pretty common in soccer. In preseason, a lot of teams have to run what we call a Cooper test. It's a 12-minute run, and they have to the goal is to get 2 miles in those 12 minutes, or a mile and 3 quarters for women. Now, making them pass that in the heat, when you understand that their pace is going to be off, that really might be an unrealistic goal, and it may be setting them up to be in a dangerous situation. So some references are here in case anybody is interested. The Corey Stringer Institute is another. I know I mentioned the National Athletic Trainers Association. Corey Stringer Institute is another great resource. This was founded by the family of Minnesota Vikings offensive lineman Corey Stringer. He passed away from complications of heat stroke, and they do a great job of educating the public and doing a lot of research on heat illnesses. Moving on, we're going to talk about concussions. And I'm going to start with the definition of a concussion, because I think over the years it's evolved from something like, oh, that athlete just got their bell rung or they got dinged or that kind of thing, to it's a brain injury. It's a complex pathophysiological process affecting the brain, and it's induced by biomechanical forces. So a force or impact to the head causing that brain injury. And the key word here is complex, because no two concussions are the same. And the management and the athlete's recovery really has to be individualized. This definition is brought to you all by the 4th International Conference on Concussion. It was held in Zurich in November of 2012. So 300,000 sports-related concussions annually in the US. Girls have a higher rate than boys, and we're going to talk about that a little bit later on. Signs of a concussion. Most symptoms happen right after injury. People will complain of those, but some take several hours to develop, and it's important to understand that worsening of any symptoms, anything that really significantly progresses, or any change in mental status of an athlete, that's an emergency situation, and they really need immediate medical attention. We're going to talk about that in a little more detail soon. The symptoms are often worse with activity or stress, schoolwork, physical exertion, just anything that's really making the brain work harder. Signs of a concussion, the most common is a headache. And that's what a lot of people will complain about. But then other symptoms, loss of consciousness, they may say that they're feeling like they're in a fog, and that might be something that you have to come out and ask them. They may not specifically volunteer that. It's important to sometimes ask about some of these things because they may not have really realized that they feel that way until you bring it up. They may have difficulty remembering. They may be irritable. Sometimes there's mood changes. Sometimes there's depression. Sometimes the athlete's more aggressive than normal. Nausea, vomiting is also a common complaint. They may have difficulty with balance. That may not be something that you'll see right away. That may be something that we see when we're doing testing. They may have some changes in their pupils. They may have blurred vision, slurred speech, and then they may have one of two things. They may either have difficulty sleeping or they may be excessively drowsy and feel like they need to sleep all the time. It's usually one of the two. So if you see any of those in your athlete, what to do? First of all, do not put them back in the sporting event. Allow them to rest until symptoms improve. So once they get home from that game or that practice or that kind of thing, understand that their brain needs to recover. And you have to minimize distractions. So no TV, no internet, no phone, but also no reading too. I think in this day and age, it's so hard for us to unplug from society and everything's electronic, and it's hard for somebody to do. But then also understanding that even just simply reading is still using the brain, even though it's not a kind of an electronic stimulation. It's something that they really probably shouldn't be doing until they feel better. It's not necessary to wake the athlete up every hour. This actually disturbs their sleep patterns, and their brain is trying to heal and they need that rest. You should check on them. As I'm going to mention in this next slide, you don't want to leave the athlete alone. You want to monitor their symptoms closely. So you can check on them at regular intervals, and that's very important to do, but you don't have to wake them up. And not leaving the athlete alone is really important because if anything worsens, they need to go to the ER right away. So if it's a college athlete, we've told their roommates to not leave them alone, if it's possible to not go out for the night, just make sure that there's somebody with them at all times. Parents of kids, even just for a little bit of an interval, you really should not leave them alone until things kind of stabilize out from their symptoms. Another thing is to avoid pain relievers. That may increase the risk of bleeding in the brain. And really, if you're not sure, when in doubt, sit them out. If you're not sure if that's really a dizziness or a balance thing, or if they're just better to sit them out. If it looks like they might have hit their head and they may have any symptoms, don't risk it. It's no sport or match or game or championship or anything is worth having permanent brain damage later on in life. And I've seen some really sad stories and situations with patients that I've worked with where they have gone back in the game because they may have thought that they were feeling okay, and then either the smallest knock to the head or even just jostling around of being in a sport, a contact sport, has made their concussion significantly worse. And then they get to the point where I've seen situations where kids have to miss, up to 3 months of school because their brain, that injury was made so much worse and so much worse than it even needed to be. There's also the risk of second impact syndrome, which could actually be fatal. So it's important to understand that it is not worth it. And even if you think about them getting their bell rung, as we used to think that's okay to go back in the game, it's not. That's a concussion, and it needs to be treated as one. So if an athlete, we're going to talk about kind of the worst case scenario right now. If the athlete stays unconscious, sometimes they'll lose consciousness and they'll kind of come to. But if they stay unconscious, call 911 right away. You need to monitor their vital signs. So airway, breathing, circulation, all of those things need to make sure, and you need to be ready. Again, as I mentioned, kind of with the heat stroke, if you need to do rescue breathing, you need to do CPR, be ready to do it. When EMS gets there, they're going to spine board that athlete because the athlete needs to be evaluated medically for a spinal injury. Signs of a spinal injury, as I mentioned, unresponsive is one, but if the athlete is with it, but they complain about numbness and tingling in the arms or legs, if they have neck pain and it's painful to touch, or if there's a deformity that you can see, or if they have this block, in their motion, like they can't turn their head to one side or the other, that could be a sign of a spinal injury, and that's another reason to call 911. Other things that you want to understand, these are emergency situations, is if the athlete has a worsening headache, if they get very, very drowsy, like if you can't wake them up very easily, if they can't recognize people, if they have significant nausea and vomiting, if they become more confused, more irritable, if they have a seizure, or if they have any kind of weakness or numbness in their arms that does not go away, call 911. They need to be evaluated for a more serious brain injury. Just to give you all an idea of what we do on the sideline, this is a tool that a lot of medical professionals use. It's called the SCAT. It's been developed by FIFA, the US or the Olympic Committee, and quite a few researchers. It's used in ages 13 or older. There's a child SCAT for youth athletes. So this is something that's done on the sideline, going over the background and history. We look at coma scale, we look at their current concussion symptoms, all those ones that I mentioned earlier, and ranking them and kind of computing a symptom severity score. We look at their cognition. We take a look at their neck because of what I mentioned about spine, possibility of a spine injury with anybody that's had kind of an impact injury to the head. We need to rule that out. But then also sometimes these athletes are finding that there's some whiplash associated with some of these concussions, and being able to screen out for that right away is important. We look at balance and coordination, and then we look at memory and recall. Another test, so that's done on the sideline, and we'll usually take an athlete when we do that test, the SCAT, to a quiet area and to minimize all the distractions for their brain and let them take that test. But another thing that we will do later on after symptoms have kind of healed, this is not done on the day of the game or the day of the injury, but this is impact testing. And some of you may have heard of this. This is an objective evaluation of brain function after a concussion, and it's a computer-based test. So it gives an objective measure because it can show the amount of recovery from an injury, but it can also, in case of an inaccurate, if the athlete is, maybe fudging how they feel a little bit, or saying that they're okay to go in a game, this gives us the ability to test and really make sure. So I'm going to briefly touch on gender differences, because this could be a whole other webinar in itself. It's something I presented on at the American Physical Therapy Association, their national conference 2 years ago. So there's quite a bit of information on it, but we're just going to do a couple slides now. If anybody has questions, feel free to email me with them. But sports, if you look at the incidence of concussions, men's football and wrestling are up there. But then if you compare women's soccer to men's soccer, women have more concussions. And if you compare basketball, women again have more concussions. High school sports, girls have a higher rate, and they have a average recovery time longer than boys. It's almost 25.9 days longer than boys, and that's almost a month longer. Female athletes also were more likely to need academic accommodations, vestibular therapy, medication. And the Zurich conference, the Zurich concussion conference that I mentioned earlier, actually said it's accepted that gender may be a risk factor for injury and or influence injury severity. If we look at, there's a lot of studies out on this, but I'm going to touch on just a couple of them right now. A study that came out in 2007 showed that female athletes had less complaints of symptoms, so they didn't complain as much, but their cognition and their reaction time was more limited. So that's something to keep in mind. They may say they're recovered and then they really aren't. It's widely speculated that female athletes feel pressure to not let their teammates down or miss playing time. Or it's also speculated that a lot of people kind of write off some of these symptoms in female athletes and women as being overly emotional, or I've even heard they're just being hormonal or that kind of thing, which is quite awful, because those are very likely their concussion symptoms, and they're presenting just a little bit differently than boys. So it's really important to just note that and understand that your athlete may be presenting a little bit differently than their brother, kind of thing. Another interesting study that came out in 2014 showed that 56% of girls soccer players, and these are 11 to 14-year-olds, so these are young soccer players, with concussion symptoms, they didn't seek treatment. And 58% of those girls in the study returned to play without being cleared. So regardless of gender, just understand that there's some differences, but overall, we need to know that every concussion is unique. So every athlete is different, and there's so many different factors in the recovery. That could include the number of past concussions, that could include gender, as I mentioned before, age, even things like time of school year. I mean, there might be more stress on the brain and harder recover around exam time. There's a lot of different things that could play into this. Some days may be even more symptomatic than others. And the worst thing that a parent or coach or teammate can do is compare that athlete to another athlete, sibling, past concussion, etc. Just, your brother recovered fine from this, so you'll be better in 7 days too. Well, it may not be 7 days, it may be 10 days, or maybe 4 days. You don't know. And you really just have to watch the athlete's symptoms and just modify their activities based on that present moment. There are some references here for anyone's interest. Then we're going to move on to ACL injury. ACL injuries cost $3 billion annually, and that doesn't even count time away from work or long-term costs associated with arthritis. There's a high rate of arthritis in athletes who have had ACL injury. If we look at the number of injuries in women's soccer, we're going to look at high school first. Basically, what these stats show is if you have 22 players, so if you have, let's say, 22 freshmen, and they play 75 games or practices per season, by the time they're seniors, there's going to be at least 3 new ACL injuries in that group. And if you look at college women, the number is a little bit less, but it's still equivalent to 1 ACL injury every other season. Now, even more staggering, after ACL injury, 91% of athletes expect to return to the same level. But only 65% of them get to that same level in 7 years. So we're not talking about, it takes them a year to get to that. Over 7 years, a little more than half actually get to the level that they were at. And it's not an issue of them not rehabbing hard enough or anything. I've worked with a ton of ACL injuries in my years as a PT. Just working with soccer athletes is one of my specialties. We tend to see a lot of these, unfortunately. And only 55% of them return to competition at all. So the numbers are kind of disappointing. And if we look at second ACL injury, so either injuring the same leg or the opposite leg, 23% of those athletes that do go back, so that small percentage that do go back, end up having some kind of second ACL injury. The highest risk is in the first 72 games or practices when they come back. So imagine rehabbing for that long, and then during that first short period when you come back, being at the highest risk for re-injury. And it does happen, unfortunately. We've seen second ACL injuries that happen in that time frame. And it is really kind of an awful thing to have an athlete go through. So how do we decrease this number? Because those numbers are staggering. Well, we can't truly prevent every ACL injury. Some of the risk factors, and we're talking non-contact ACL injuries. These are people that have plant funny and have their knee buckle under them. Those risk factors include there's anatomic, there's genetic, there's a gene that the makeup of the connective tissue in the ACL itself is a little bit different, and that's a risk factor. There's hormonal, but then there's neuromuscular, which is called, basically neuromuscular is the muscle control or the coordination of an athlete. So it's different than strength. Strength is a component of it, but it's how well or strong a muscle can work at a specific time. So when that muscle can turn on at the right time to protect the knee. And then biomechanical, we can modify that factor. And I'm going to go over within those neuromuscular or biomechanics, there's risk factors within those that are for ACL injury. So the first one's ligament dominance. This is where the knee collapses inward. We call it knee valgus. It's basically just an inward collapse of the knee. And the knee, when this happens, you don't have as much bony stability of your knee or muscular stability. You're kind of just hanging on the knee ligaments, most notably the ACL. So that absorbs that impact instead of the muscles of the leg. And this is some people's tendency that their knee just kind of buckles inward when they're planting on it or jumping on it or turning on it. And if it goes too far, it can get to what we call the point of no return, where they're just hanging on that ACL and it can rupture. So working on retraining this is very important. Another thing, quadriceps dominance. This is an imbalance of the muscles or that kind of muscle, like I said, that coordination or that timing of those muscles working between the quadriceps and the hamstrings and glutes in the back of the leg. So the quadriceps tends to be a little more dominant, and that is throwing off the mechanics of the knee. Leg dominance, unfortunately, you're only as strong as your weaker leg, and that includes any past injury history. So things like ankle sprains, previous knee injuries, things that would cause one leg to be weaker than the other, put that leg at risk for ACL injury. So if you come down from a landing on your weaker leg, coming down from a header or a rebound, and your body weight's on that leg and it's not supporting it the right way, you can rupture that ligament. Poor trunk control. Trunk or core control, as we call it, it's different between males and females. Some of that is due to our stature, just different makeup. Now, looking at single leg plyometrics, so this was studied by having males and females kind of jump and land off of a platform and looking at their core control. It has been shown that it's linked to ACL injury. It actually was in a couple studies called highly sensitive for prediction of ACL injury or knee and ligament injury. So knowing those risk factors and knowing what we can modify, what works when we do that. So ACL, what I'm going to call risk reduction programs, they incorporate a bunch of different things. We work on core stability to work on that trunk control, work on balance and stability of the leg. Plyometric training is really important. So retraining how the athlete jumps and lands or plants and cuts. We look at strength training because it is a component. Then working on agility. Some programs do have stretching in them. I don't tend to use it as much as I want to work more on the control, but if an athlete does have a range of motion or a tightness, that does need to be addressed. But then also giving feedback on their technique when they're doing all of those things, when they're doing their plyometrics and strength training. And that feedback is actually very important too. We're going to talk about that in a little bit. Which of these elements is more effective? So when an athlete doesn't have time because they're trying to compete and play in their sport, if they're limited, what is the most effective thing? Should they just work on plyos or should they do balance or core? Well, unfortunately, really no one single training intervention is found to be effective. So you really have to incorporate all of those in your ACL injury risk reduction training. This was a study that came out in 2014 that talked about that. Another study, though, we know what to do with these athletes, but how do we do it? And this is, in my opinion, is a fantastic paper that came out in 2013 that talks about kind of the how. And what they found looking at that study is that 68% of non-contact ACL injuries. So that doesn't mean, the football player that gets tackled on the side of their leg or the soccer player that gets slide tackled. These are the non-contact where you plant funny on your leg and your ACL goes. Those injuries can be avoided. 68% of them can be avoided if you train in a preventative NMT's neuromuscular training program. If you train more than 20 minutes per session and at least twice a week. The other thing to understand is that an athlete's not going to see results right away. It's going to take a few weeks. So something that was mentioned in that paper was seeing more results at the end of a season versus at the beginning, which sometimes at the end of the season, things kind of tend to break down in some athletes. They get tired, they get fatigued. So that's actually kind of a good thing when you want them to be healthier at the end of the season. And some studies have shown that less ACL injuries in the second half of the season versus the first. Now, I mentioned feedback on their athlete's technique, and the type of feedback and the type of coaching you give them really does make a difference. So this is a topic for, again, a whole nother webinar. This is something I've presented on pretty extensively. I'm happy to take questions as needed, but just understand, there's a blog post that I wrote on this topic, but the type of coaching makes a difference. So when you're teaching an athlete a skill, so when you're teaching them how to do plyometrics, how jumping, they can have one of two ways to focus on that skill or that technique. One is an internal focus, so the athlete's thinking about their own body position. So example, if you were teaching them a layup, which is a little different than ACL injury prevention, but just for the sake of the explanation here, if you're teaching a basketball player how to do a layup and they're focusing on where they put their feet, that's an internal focus. They're focusing on themselves. If they have an external focus, so they think about the environment and where to place the ball in that layup, that is more effective because they're going to retain that better. There's studies that are showing that their training effect is going to be quicker and that technique is going to become a habit quicker. We're going to briefly talk about fractures and muscle strains. So how do you know if your athlete has a fracture? Do you know if you should take them to the ER or the urgent care for x-rays? The OTTAWA ankle and foot rules is something that we use as medical professionals that basically it's a little more complicated than this, but for general knowledge, understanding that athletes should have an x-ray if they have pain in the ankle or their midfoot. But then if it's painful to touch and it's point tender on any of the bones, and if they have an inability to weight bear. So if they can't pull weight through their leg, it's tender over an area of the bone, and obviously it's painful, they should go in for x-rays. And that can be kind of extrapolated to different bones in the body as well. For anyone who medical professionals that want a reference, this is from the Ottawa Ankle Rules. It's available online. If you suspect your athlete is a muscle strain happens when a muscle stretches too far. I think it's everybody's first instinct to stretch it further and just keep stretching. That will pull the fibers even further and perpetuate the injury. So do not stretch a strained muscle. You want to keep it moving though, and you want to keep it as loose as we would say as possible, but just not overstretching and over tearing and doing more damage. So you want to stay in a pain-free range of motion. So what I usually tell people is if it's a hamstring strain, I do what we call a heel slide, which is basically the athlete's laying on their back and just bending and straightening their knee, just gently, just dragging their heel on the surface in a pain-free range. They shouldn't work through pain. Doing that every couple hours. Quadricep strains, doing gentle leg extensions. This is just sitting in a chair or on a bench, just kicking the leg straight out and bringing it back, just gentle range of motion. Once the athlete regains that full range of motion, you want to start what we call eccentric training. And that is basically what eccentric is. It's kind of the negative phase of an exercise. So if you were doing a bicep curl, the bicep curl where you're bringing the weight and you're bending your elbow, that's the first part. That's what we call the concentric phase. When you're lowering that weight down, your biceps actually has to work harder to lower that weight to the ground and prevent it from just dropping it on your foot or on the ground. So the muscle actually has to work harder during the negative phase, but that can kind of help with healing of a muscle strain. So you want to attack that muscle in that kind of phase of work. So for somebody a hamstring strain, what I would have people do is straight leg deadlifts in a pain-free range. So starting out with no weight or very, very lightweight, 5 pounds, that kind of thing. Straight leg deadlifts are also called good mornings for anyone who's unfamiliar. And then progressing to single leg. And I'm going to show a picture on the next slide. I'm going to skip ahead. These are single leg deadlifts or hip hinges where you're just keeping the legs straight and you're lowering a weight. I would probably start people without weight. And if I need to, sometimes I've cut down the range of motion by having them stand in front of a table or something that they're going to lower their hands down to that table and instead of going all the way down to the ground, but then progressing to adding weight. For somebody who's a quadricep strain, I would start with something like just a body weight squats and then moving on to lunges in a pain-free range. And rehab can kind of guide people through any other strengthening that you need to do and a progression back to their sport after it's gotten stronger. Last thing I'm going to touch on is signs of burnout in athletes. As I mentioned, I think this is really important, especially in those single sport athletes that are playing one sport year round. But to understand how an athlete could get into burnout, it's important to understand rest versus recovery. Your body needs both. Rest is basically time spent not exercising or training or exerting yourself. So that also means not walking the dog, not gardening, not mowing the lawn, not hauling groceries up and down steps, not cross-training. So it is rest. Your body is resting. Recovery is any actions taken to repair the body. So foam rolling, stretching, yoga, cross-training, doing a pool workout, Alter-G running, those things are recovery. Your body needs both, and it needs to find a fine balance between those two. Sometimes it's different day to day or week to week, but listening to the body and giving it what it needs when it needs recovery or rest is very, very important in avoiding burnout. Now, what are signs of burnout? Loss of appetite, predisposition to injury, just things nagging, injuries kind of cropping up all the time and not understanding why this keeps happening. Frequent colds, that feeling of like your legs being heavy. I know I've experienced that feeling. Sleep problems, you may be too tired or you may not sleep at all. Apathy, feeling intimidated by opponents instead of feeling ready to challenge those opponents. Being in a bad mood, feeling sad, lack of confidence in your competition. So all of those things, if they are happening, it's important to understand how to take a step back from your training. And that's something that either a coach can help you with, a psychologist can help you with, a sports physical therapist can definitely help you with, kind of trying to gauge the training and scale it back, or finding other activities that would be equivalent that would kind of help combat signs of burnout. We took Q&A last night. If anyone has any questions, feel free to email me at info@clesportspt.com. And thank you very, very much for your time.